Welcome to the Integrative Medical Discussion Group. Thank you all for being here tonight. My name is Deb Davies, and I am the Director of Alumni Services and Community Education here at the college. And tonight I have Honani Chong, a PCOM student, co-facilitating with me. And we want to welcome you all here. Thank you all for coming for tonight's event about integrative pediatrics. We had a sign-in sheet in the back, so if you guys didn't get a chance, we like to keep everybody up to date with all of our meetings and events. And it's so exciting to see the growth here. We've been doing this for 3.5 years now, and it keeps growing in size. So thank you all for being here. Basically, this part of the meeting goes from 7:30 to 9. Just going to talk for a few minutes, and then I'll introduce each of our panelists. We have one coming a little bit late, and we had some child care issues, so it's one instead of two. And so each person will get a chance to talk about how they work integratively with integrative medicine, what they do, and then we just open the floor up for questions. Tonight, because we have such a large crowd, we're going to actually pass out papers to everyone, and if you have a question, to write it down, and we'll collect it. If you have a question, you'll just be able to raise your hand with the paper, and Honani will come around and collect it, and we'll ask the relative questions just to help control the crowd here. There is, just because of the size, the crowd is growing here. This is exciting. You guys are welcome to get up and get food in the other room if you need to, use the restrooms, whatever. So basically, this group started 3.5 years ago. It was formulated after UCSD has a group called HI-Med. It stands for Holistic Integrative Medical Group. And they would invite, it was a bunch of med students and doctors, they would invite acupuncturists, acupuncture students. So I was going to the meetings, and after a few meetings and me telling people, I had 40 PCOM students show up at this doctor's house one time. And they're like, Deb, you need to start your own meeting. So Laura Koljanen and I started this together. She helped me 3.5 years ago. And it's just grown. So basically the purpose of our meetings is to integrate Eastern and Western professionals and to educate the public on how powerful it can be when the medicines are combined. The word doctor comes from the Latin word docere, which means to teach. So we think it's really amazing that that us as doctors and healthcare professionals, not only we're helping other people, but we're teaching people about how to take care of themselves, how to better take care of their patients, as well as empowering them with options in their healthcare. So we have a few guidelines. Basically, we want to speak in a language that everyone can understand. So if there's ever a time where anybody doesn't understand a word, if acupuncture uses chi or something that's confusing, please ask, because chances are somebody else doesn't understand as well. And to basically bring in the essence of what you have to say, time, being conscious of the time. And Honani's going to be our little bell ringer. So if you're blabbing too much, basically, we're going to ding you, and we want everybody to get a chance to talk. We had a huge meeting in our last time, and we used to go around and introduce everybody, and it was really awesome. But because of the size and the time restraints, we're not able to do that. So if you do comment, and we ask that you stand up, state your name, who you are, your profession maybe, and then ask, or make the comment so people understand, and then they know who they want to talk to afterwards. And you guys are welcome and encouraged to network after the meeting is over at 9. So I'm just going to introduce our speakers briefly here, and then I'll give them the floor. So this is Aaron Cook. Aaron Cook is my hero. He's who I want to be when I grow up. He's one of the key people with integrative medicine in San Diego. He really goes above and beyond the call with working with homeless, with children, with the elderly, all over the place. So he'll talk a little bit more about what he does. And there's a bio sheet and an info sheet on the Integrative Medical Discussion Group. Everybody should have that if you want to read more about that. And then we have Leslie McCoy. Leslie is a professor here at the college, and she's also a doctoral fellow, she finished her doctoral degree here. And she works a lot with children as well, and has a few children of her own, and she's going to share some of her experiences. And then we have Dr. Marcy Bothwell, who I met back in April, I guess, at Ryan's Healing Arts Festival. And she's just a fabulous doctor that I've come to like, and she was gracious enough to be here tonight. She's an ENT specialist at Children's. So, and then we'll have one more. Dr. Joe Merlot is going to show up. He's a chiropractor, and so he'll just pop in when he gets here, and he'll be able to speak. So I'd like to have Erin start here and basically just talk about what you do integratively, or what you'd like to do, and what you see the future of, and